Hello everyone, my name is Gretchen Kiles and I would like to present high blood pressure among African Americans. During the course of this video, you will hear me use the terminology blood pressure and hypertension interchangeably. Let us begin by defining what is blood pressure. Blood pressure is the force exerted by circulating blood against the walls of the arteries. Bunker 2014, page 50 through 59. Hypertension is defined as a BP of 140 over 90 mmHg, which is millimeter over mercury, or higher. National Institute for Health and Care Excellence, NICE, 2011A, Box 1. Understanding blood pressure and its reading. If we would go back and refer to the BP of 140 over 90, the top number would be 140, and it's actually referenced as the systolic, and it's characterized by contraction of the heart, driving blood into the aorta and pulmonary arteries. So in other words, that it measures the pressure in the arteries when the heart beats. The bottom number would be 90. The bottom number is referenced as diastolic. It's characterized by blood entering the relaxed chambers of the heart. Again, that it measures the pressure in the arteries between heartbeats when the heart muscle is resting between beats and refilling with blood. Bunker 2014, page 50 through 59. I would like to reveal some very key factors. High blood pressure signs and symptoms, and how is it diagnosed? High blood pressure is called the silent killer because often has no warning signs or symptoms, and many people do not know they have it. And rarely, high blood pressure can cause symptoms like headaches or vomiting. High blood pressure signs and symptoms, no dates. How is it diagnosed, you ask? There's only one way to know whether you have high blood pressure. Have a doctor or other health professionals measure it. Measure your blood pressure regularly. It is quick and painless, and it's the only way to know whether you have high blood pressure or not. What is it the doctors are looking for? What are the signs? They're looking for blood pressure levels. If it's normal, the systolic would be less than 120 mmHg. The diastolic would be less than 80 mmHg. At risk, pre-hypertension, systolic would be 120 through 139 mmHg, diastolic 80 through 89 mmHg. If it's high, systolic would be 140 mmHg or higher. Diastolic would be 90 mmHg or higher. The rate of prevalence high blood pressure among the general population. Hypertension represents a major public health problem in the U.S., affecting an estimated 50 million Americans. Douglas, 2005, page 1 through 6. There is no significance in change in the prevalence of high blood pressure among U.S. adults from 1999 to 2000 to 2007 to 2008, and this was true for men and women, all age groups, and for non-Hispanic white, non-Hispanic black, and Mexican American adults. This can be found at the www.cdc.gov. I have also highlighted percentage awareness and those on medication. The frequency of high blood pressure among African Americans, according to Douglas 2005, the prevalence of hypertension among African Americans is estimated to be the highest in the world, wherein prevalence of blood pressures greater than 180 over 110 mmHg was 9% in blacks and less than 1% in whites. This validated earlier observations which suggest that the prevalence of elevated blood pressure with a DBP greater than 115 mmHg was 5 through 7-fold higher among blacks than whites. Pages 1 through 6. If I may give you a brief synopsis of the determinants as it relates to high blood pressure among African Americans. Dietary behavior patterns and blood pressure in African Americans range from weight, sodium, alcohol intake, smoking, adequate potassium, calcium and magnesium. Racism and social support predict blood pressure reactivity in blacks. The hypothesized psychosocial stress association with environmental events such as racism is among the explanation. We also have repressing anger and anger provoking manipulations. We also have working extremely hard while not giving up on difficult and demanding tasks. All references are notated. Ironically, according to Non-Gravely and Mulligan 2012, genetic factor is a determinant regarding high blood pressure among African Americans, yet they have no evidence of a statistically significant association between the two. Pages 1559 to 1565. Biological age, gender, geographical location also played a factor in this. That African Americans, it is documented that they are more salt sensitive. According to Douglas 2005, pages 1 through 6, researchers have also notated that high blood pressure in African Americans begin before the age 10 years, and oftentimes it's during the pre-adolescence years of overweight African American children, particularly 8 through 11. Sower, Fernandad, Patrice, and Douglas 2002, page 24 through 6, 29 through 30, 33 through 4. We also see that geographic birthplace and current resident birth both appear to affect risk of hypertension and related death. Again, Sower, Fernandad, Patrice, and Douglas 2002, page 24 through 6, 29 through 30, 33 through 4. Last but not least is the determinant of education. And we'll see that across the analysis, we found that the association between education and blood pressure was stronger in African Americans than in whites, suggesting that the educational inequalities may contribute in part to racial disparities in blood pressure. And the differential association between blood pressure and education across racial groups contribute to the long-standing debate over the relationships among SES, race, and health. Non-Gravely and Mulligan 2012. The web of causation is a visual aid and a replica of the determinant factors that have already been before mentioned. Here we see how the determining factors is all linked to high blood pressure among African Americans. As a social worker, it's quite common to recommend a social work or social justice response or strategy that has been implemented to address high blood pressure. Let us begin. Inequality in health, implications, social works, social justice response strategy. The article began by noting the growth of inequality or equality in the United States. In light of the relationship between inequality and health, we may predict that the United States will face a wide range of physical and behavioral problems in the years ahead. Social workers can play a unique role in addressing this issue. The inequality in health literature reveals that health is essentially a biopsychosocial phenomenon, and social work researchers can add to this literature. In addition, as the largest group of mental health providers, social workers can provide insight into the role of psychosocial factors and the relationship between inequality and health. Finally, social justice and advocacy have long been central to social work mission. And in a sense, we are obligated to become involved in efforts to reverse the trend towards growing inequality. Heart to Heart is a community-based program that helps to assist high blood pressure. That it operates by using a holistic community-based approach to address health inequalities while preventing the high blood pressure and health disease in South Berkeley. Heart to Heart serves as a bridge between community programs, resources, and services that are necessary to address the needs of the community members. So again, the population that it actually serves is the community at large. It's in partnership with Lifelong Medical Care, community members, and other community organizations. They provide information and resources and promote healthier living in selected Berkeley County. While it doesn't specifically mention if it has been tested, it does serve again as a bridge to other community-based organizations and is a part of the City of Berkeley Public Health Division. Heart to Heart program, noted. The Affordable Care Act is a policy that is designed to assist African Americans that do have high blood pressure, it's Title IV, Prevention of Chronic Disease and Improving Public Health. So the preventative service provision applies only to people enrolled in job-related health plans or individual health insurance policies created after March 23rd, 2010. If you're in such a health plan, this provision will affect you as soon as your plan begins in its first new year or policy year on or after September 23rd, 2010. There are services designed for adults, women, children, family, and seniors. Preventative care, no day. It's important to note that the Act will promote prevention, wellness, and public health and provide an unprecedented funding commitment to these areas. The Act empowers families by giving them tools to find the best science-based nutrition information, and it makes prevention and screening a priority by waiving co-payments for America's seniors and Medicare. Preventative care, no day. Finally, in my conclusion, globally, hypertension is one of the most prevalent medical conditions and in developed nations. One of the most important modifiable risk factors for cardiovascular disease and mortality. Although treatment of hypertension is associated with a 20% to 25% reduction in cardiovascular events, it is commonly unrecognized and undertreated. Policymakers and healthcare professionals have made extensive efforts to improve hypertension prevention, detection, and management through national knowledge, translation, and public health programs. Thank you.